the risk analysis tool, just because I think it's also very important. And then Dr. Sitine at the end of the day will just go quickly through monitoring and evaluation. But really what we want to focus on as a central theme is the root cause analysis. Okay. So it doesn't matter what kind of framework you come from, whether you use the improvement framework, whether you use the performance improvement framework, whether you're a TQM person, total quality management person, whether you're a quality assurance person, we all converge at this point of there's a problem and we need to know what is causing it and we need to know what to do about it. We don't have time today to go into the what to do about it, but I think at least we can go through the tools for analyzing what is causing the problem. And hopefully, if you're interested enough, you can go and look up the toolkit. It's there, and you can look at the other tools. So I'll start with analyzing our implementation bottlenecks. Normally, what happens in our settings is that things are not working. What you just see is things are not working. There's a problem there. You may not even know what is causing the problem. For example, for TB-HIV, we notice that there's low uptake of ARTs, antiretrovirals. Okay, we don't know what is causing it. We notice that there's low uptake of cotrimosis or prophylaxis. We don't know what is causing it. So these are things that you see every day. You look at your indicators and you say, it's not working. It's not what I expected. So how do I go about analyzing those implementation bottlenecks, which in reality are problems? Okay? They're the problems that you're facing. Because what you want to get to is to get to the point where you can address that implementation bottleneck so that you get rid of it. Now, root cause analysis has an analogy. If you have a tree and you want to get rid of it, you don't start by cutting off the branches. You know, you cut off the branches, what happens? It just grows. It just grows better, okay? Because you've pruned it. You cut off another branch, it just grows better. And sometimes you try to deal with programmatic problems in that way. There's a problem here, so let me just sort this little thing. But you're really not getting to the root of it. If you want to get rid of a tree, you attack the taproot so that it dies, okay? So that the life of that root actually dies and the tree dies. Am I going too fast? I can see you look a bit puzzled. You okay? Okay. So you think of root cause in the same way. You're looking for that cause which if you remove, if you get rid of it, the problem will go, okay? It will actually go, or at least reduce substantially so that you can deal with it. So that is what we are trying to do. So bottlenecks, we all know that those things that slow down the process, or they cause the whole process to slow down or to stop, they hinder progress, and there are problems. Really, there are problems. There are difficulties that need to be resolved. Problems is a set of affairs plagued with some difficulty, a challenge that encourages solving to establish the desired state. Okay. Now, an essential aspect of root cause analysis is understanding the problem. You must understand the problem. Trying to address a problem you are not understanding really is futile. You must understand it. If people are grumbling and complaining, you need to take the time to understand what it is they're really complaining about. Because the symptoms are do not always make obvious the cause of the problem. Sometimes people just start grumbling, but you don't know what they're grumbling about. So you have to dig a little bit deeper so that you can actually get to the root of the problem. So really, you must understand the problem. Now, there are many tools that you can use for understanding the problem, and I'm not going to bore you with all of them today. I'll just select a few commonly known ones and ones that we can do with this time. So just look at the problem pentagon and look at the flowcharts. Okay? Those are very common. Those are commonly used. The other three you can look up if you like. Causes can occur at different levels. Okay? I've already mentioned the symptoms and the signs of a problem. And then you have what you call first level causes, higher level causes, and root causes. So what we are saying is, when you see a symptom, there may be different levels of causes. What you really want to get to is the very fundamental cause, which is the root cause. Because the root cause is ultimately the creator of the problem. The other things are just adding on. Okay? So we want to get to the root cause, as I have said already. Let's look at that. Okay? This light is a bit of a problem. That's what we mean. There is a symptom. That's what you're seeing. Okay? Right at the end of the spectrum, that's what you're seeing. Then there will be other things which are they feel bad because they're not well paid. You just say that because that's what you assume. That's what they're complaining about. But then there's another cause behind that. Why are they not well paid? Okay? Maybe it has to do with resources, maybe it has to do with budgeting, maybe it has to do with priorities, maybe the person just isn't bothered, they want to pay them a lot, whatever the reason. And then say, but why is that happening? So there's a reason why whoever is supposed to be paying is acting like that. And you want to get finally to the fundamental cause. Why is it really happening? What is really the fundamental causes? What is that thing which when we address will actually get rid of the problem? So this is different levels of causes, and I just wanted to emphasize what you want to get to is the actual root cause. Welcome to those who just come in. I've just started, so you haven't missed much. And once you've got the problem, I think it's obvious. You want to address the real cause. If you, as I said before, if you address the symptoms, you may just make it worse. For example, what we do in our programs is people complaining about money. Money is usually the thing they complain about. So we try to solve the problem by giving them allowances. And you know that you've created a monster of a problem? Because now, each time you say, let's do this, allowances, how much are you going to pay us? People no longer work for their salaries. They now work for the additional. Then you want to ask them, excuse me, but you've contracted 8 hours. This work I'm giving you is still in the 8 hours. Why am I paying you extra? No. For projects, you pay us extra. You get the problem. That is dealing with a symptom. We never dealt with the real problem. So in trying to deal with the symptom, we created a bigger problem. Because now, at least in our part of the world, we are finding it hard to run anything. Because as soon as you say, they say, nah, first of all, how much is this going to, how much are you going to pay me on top of my salary? So that is dealing with the symptoms. So we really want to not deal with the intermediate causes. We really want to deal with the root cause. That is just for our understanding of what we're going to go through today. We want to understand the problem first, and then we want to do the problem cause brainstorming, the data collection, the problem cause data analysis, and finally the root cause identification. And normally, which we're not going to do today, you're going to problem elimination, solution implementation, and you monitor and ensure that the problem does really not recur. First of all, recognize that there's a problem. Define the problem with the key stakeholders. Call the problem by its real name. What do we mean by that? When people say people are demoralized because they're demotivated, exactly what is demotivating them? Call the problem by its real name. Define it succinctly so that you can say, yes, the problem is this. The problem is the packages are inadequate, the salaries are low, they are not commensurate with the cost of living. That is really the problem, okay? And so you start now analyzing it, and you agree. By the way, when you do root cause analysis, it's very dangerous to do it by yourself in your own little corner. Because when you do it by yourself, you only look at it from your own perspective. And you conclude from your own perspective. And your perspective may not be the same as the perspective of the people whose problem you're trying to solve. So in root cause analysis, which is really good, we encourage that the stakeholders, the people who have a stake, an interest in what you want to solve, should be part of that problem-solving process. Okay? Why? Because, in fact, when you are together and you identify the causes together, in those causes, some of the things will be them. And some of the things will be the system. And some of the things may be you, whoever you is. So it is good to get together and really start going through. And as you're reasoning through, people begin to realize, actually, yeah, I think there it's us. Yeah, I think there it is the system. I think there's a fundamental weakness in our procedures or rules and regulations. So you always do root cause analysis with the people who are involved in the problem. Okay? And we shouldn't be shy about calling it what it is. You know, we like to give nice diplomatic names to be politically correct. Root cause solving is not about being politically correct. It's about getting rid of the root cause. Okay? So we have to be honest about that. The other important thing you have to do is to assess whether a problem is worth going through with the process of root cause analysis. Root cause analysis will take your time. Because it's taking time, it will take your resources. It will take people away from their work. So it is actually a costly process. So before you start root causing, you really should decide, is this a problem worth investing in, or is it something that can just be sorted out very easily without going into a lot of expenditure, a lot of energy input? And of course, old idiom, prevention is better than cure. It would be nice if we didn't have problems, wouldn't it? We wouldn't have to do root cause analysis. So sometimes even preempting problems and putting systems in place which avoid obvious problems is a good practice. But inevitably, you will get problems, and they will need to be addressed. So, what do we do then? How do we go about this? A logical way of going about this. There are a number of tools, as I said before, which help you. The problem pentagon, which we will do today, is very easy, very obvious, but it's worth doing and thinking through. That just helps you to determine, is this problem worth addressing? Before you go into all the business of finding tools and what have you, ask yourself, is this problem worth the investment? So you use a problem pentagon for that. Flowcharts help you to locate and to understand the context of the problem. Because, you know, when you're thinking of causes, you must have a context in which to think about that problem. And flowcharts are very good for that. Spider charts, which I'm not doing, are really benchmarking. Is our problem any bigger in our institution than in other institutions? Or is it just the same and it's one of those things, you just ignore it? You can have a performance matrix. This gives you just the importance of the problem. How important is it? And critical incidence is, what are the critical issues in that problem? You know, when it occurs, what are the critical issues? So we'll look at the problem pentagon first. Very easy, but very important in terms of helping you. What the pentagon does is it asks you what is the problem, where is it occurring, when, who, and finally, worth. Is it really worth addressing? That is very easy, and it's something we use, for those of us who use the performance improvement approach, use this a lot, because this is something that health workers can relate to. There's no rocket science in it. It's just helping you to think through. So what? Is there a problem?